Hi, y'all. What you know good today? Welcome back to the Not Today Murder Titty Show. This is episode number 3. And as always, I'm your host, Dawn. And thank you for joining us. Thanks for coming back. If you've never been here before and this is your first time, I have episodes 1 and 2. Please watch them. It'll make a lot more sense. But I will give you a little bit of a recap. I was diagnosed with breast cancer just recently. I call this cancer Helga because she is a tyrant. And she's trying to kill me using Lucy and Ethel as her hitmen, and I will not allow it. She's a tough cookie, but my tenacious wit and stubborn determination to not die is not going to allow that to happen. So anyway, this particular show is, as you can see by the title, is about my fight against this bitch Helga and breast cancer and my journey, my personal journey, and I do it in a way that is just adds some humor and brevity, and it's real and it's raw, and I just tell it like it is. And so hopefully you'll stick around. Thank you for joining us, and we'll just dive right in to what's going on now. Okay, so when I talked last, we were talking about having I had to have a lymph node biopsy and the pore implant procedure. So I did have that. And let me tell you something, that was awful. Actually, awful is probably not the word I would use to describe that. I would say that that was just the worst day. Like, I have had better days. Okay, many better days. And that day was a bad friggin' day. Okay, and there's a reason for it. Okay, so I found some things out the hard way, you guys. Okay, and someone who, when I need to know something and I have some questions about something, I do a lot of research. I'm someone who researches a lot. I will read medical journals. I will read all kinds of documentation just so I can get a clear, full picture of exactly what I want to know. But I didn't know this yet. And so I'm going to take y'all to school today for just a minute. Okay, so bear with me. I'm going to teach you something, okay, that I didn't know. So, did you know that less than 2% of the entire world's population has natural red hair? Less than 2%. I mean, that's pretty rare, okay? And it doesn't matter the tone of red. It could be orange, it could be pink, it could be bright red, it could be ginger, it could be auburn, it could be strawberry. It doesn't matter. It's just rare to have that that trait, that red hair. Also, in addition to being relatively rare, natural redheads come with our share of medical anomalies. Okay? Isn't that nice? In addition to being rare, redheads have a higher tolerance for pain than others, which I did not know that. Also, redheads have a natural resistance to pain medication and anesthesia. This is good to know for the future. But I found out the hard way, okay? Redheads require 20% more medicine than average, and it takes 20% longer for that medicine to come to full effect. So if you get a shot of lidocaine and it normally takes 10 minutes, 5-10 minutes to numb, it takes someone who has natural red hair much longer than that. Okay, did not know that. There's a reason for that, because there is a gene that redheads carry. And redheads the only ones that carry it. It's called MC1R, and this gene has receptors that block when your body is trying to absorb the anesthesia, and that those anesthesia, what happens is it blocks the nerve pain, so you don't feel the pain. This gene blocks that, and so it kind of steps in front of it, and it keeps that from happening. So the medication, they need more, and it has to work harder, and it has to work longer. Needless to say, I didn't know any of this, and it's not common knowledge, even though it's statistically proven, okay, in medical journals. Not common knowledge, okay? So, that all being said, okay, that whole entire day was a dumpster fire. Like a complete and utter dumpster fire. It was the worst day ever. I was in the most pain. And I mean, I'm a pretty tough cookie, okay? I can handle pain. I've had children. I've, broken bones. I've done things that can cause a lot of pain. And when you have pain so bad that it makes you want to throw up, like that kind of pain, it's pain, okay? But let me tell you something. I felt everything, like all of it. I felt all of it, okay? The lymph node biopsy, and you're laying in there and you go in and they put you up on the table, and you have to, like, I had mine in my lymph nodes in my armpit, and so my arm is up like this and I'm kind of lean over like this, and this is where they have to go, right? Well, there's like 3 people in the room, the lady that's doing it plus the doctor and a couple of other nurses, and she's telling me exactly what they're going to do and when they're going to do it. And I told her, look, I'm a little nervous, but and I was, because the first biopsy I had was horrible. And she's like, okay, we're going to talk you through it. It's going to be great. And then they tell you, you're going to feel a little stick, for the first lidocaine shot, right? This little stick. And I'm like, okay, little stick. So it's not a little stick. That bitch hurts, okay? It hurts a lot, okay? Normally, it's supposed to only take just a few minutes, except it took longer than that because I waited a little bit, and they're like, now you need to let us know if you feel anything, or if you feel something sharp, you need to say something. And I said, okay, because I had to get like 3 shots, right? So you have like one and then another one, and then they have to give you another one really deep where they actually have to go and get the tissue, okay? I felt it all. I'm telling you right now, like I was crying, and I mean crying out loud, swearing. I said things I should have never said in front of people, and I said them, and it was bad. And I was bawling, and then I felt embarrassed because I'm like, am I a pansy? Like, why does this hurt so bad? Because I could feel everything. I mean, it hurt so bad, and I was just crying. And they bring this other nurse in. They call her I'm guessing she's like an anxiety whisperer or whatever. Anyway, she's supposed to be that person that holds your hand and talks to you and keeps you calm down. And I was thankful to have her, let me tell you something. But it did not help the pain at all. I told her, I looked right in her face. She's like this close to me, and I'm laying there, and she's like, I just need you to breathe me. And I said, I'm going to tell you straight right now. That medication to numb is not working. And I can feel everything. And they have to take 3 samples, and it's a click, boom, 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 every single time. I can feel it. I can't wait for them to get done. And I first, like I said, I was super embarrassed about it because I'm like, why? They're going to think I'm some sort of ridiculous pansy because I'm throwing a fit. Okay. I'm not going to lie. And, yeah, it didn't work. So we get done with that. Okay. The whole thing. And this nurse, she was so sweet. And she hands me an ice pack, and she says, okay, so later, this is what she says, later when the numbing stuff wears off, that you can use this ice pack and that'll help. And I said, I will use the ice pack now. I said, nothing is numb. And she goes, it's numb. I said, it's burning. Like I couldn't lift my arm because I could feel the burning where the incision was. Like it was awful. And so she's like, okay, so she breaks it up so it'll get cold. And I'm able to get my arm up enough to slide it under there. Okay. And I'm just holding it in. And then she's, giving me some advice of what to do, which was great. And then I go to leave. Now we have to go right from this appointment. We have to go to another building that's attached to this building, just in another place, to have this port procedure, which is an outpatient surgery. I'm miserable. Okay. I come out and I walk out, and Jay's in the waiting room, and he takes a look at me, and he's like, Jesus, what happened to you? Because I looked a mess, that was a rough experience. And I said, it was awful. Like I felt everything. It was absolutely terrible. So needless to say, because of that, I was really nervous about going and getting this port procedure. Okay. So we get over there, we get checked in, and I'm sitting there waiting. And then they call me back, and I go into the room to put on my designer gown because I have to get in this gown again. I've already changed once. I got to change again. this, from the time I left, they gave me the medicine, okay, till the time I'm in there to get this, to get changed, it's about 40 minutes. As I lift my arm up to take my shirt off to put my gown on, that's when I notice it's numb. Finally, numb. I feel nothing. 40 minutes later. The hell? Really? Now it's numb. Okay. So, I get my gown on and I go in this room and they have me and they lay out in the bed and I lay in the bed waiting. And they have Jay's in the waiting room. And so she's asking me questions and she's telling me a little bit about it, about what's going to happen. So I'm going to tell you about it, okay? So a chemo port is called a portacath is what it is, which means it's this little disc that has a catheter attached to it, okay? The disc is this little round disc. It's about like that big, okay? And it has like this gel in the middle of it, okay? And the gel, this disc sits right under the skin. So they make an incision and then they slide the disc right under the skin, okay? And then they, put the Dermabond glue or whatever, however they close it. Everybody does it different. And then that heals up. And so then there's another incision up in your neck. And so that then they has a catheter that comes from this little disc and actually hooks into your jugular vein. Okay. The reason that you have a port is because they have to get this medicine into your body. Okay. You don't want to have an IV every time because an IV can't be started every time it happens, okay? In addition to that, you have to have lab work done every single time you have an infusion. So they have to stick you again. Everything can be done through this port, okay? Now, I was confused. I'm like, well, how do they access it? Because it's covered, right? It's under your skin. Well, this is how they do it. They take this needle, and this special needle is called a Huber needle, okay? And this needle, actually, they find where it is, right? And the needle snaps through the skin into the disc, okay? As soon as it hits that disc, it immediately is connected to your jugular vein, okay? Now they can take blood out for samples, and they can put medication in, all just with this one port. Now, through the skin, that sounds awful, right? I don't want to go through that. There's a cream that they give you. It's called an Emla cream. And this Emla cream you put on, and you're supposed to put it on like half an hour before your procedure. And what it does is it numbs the area. Well, considering what I've been through and what I know now, I know I'm going to have to use that like at least an hour to an hour and a half before. But that'll be for later, okay? But for I have to get this port in so I can have chemotherapy, okay? So anyway, we go in, they take me into this sterile OR room and, to get me started. And they tell me, because I have an IV, right? And they tell me that they're going to give me the good stuff, okay? The good stuff in the IV is what I'm supposed to get first. This good stuff is supposed to make me not care about what's happening. I'm supposed to not care. It has like an amnesiac effect, so you won't remember stuff. It makes you super sleepy. It takes your anxiety away. All of the good stuff, right? And I'm like, sweet. I'm looking forward to the good stuff because I don't want to have any memory or recollection of all of what is going to happen. So she's like, okay, we're going to give you the good stuff. So I'm laying there and they give me the good stuff and nothing happens. And they wait a few minutes as they're preparing me to do this. I have to turn on my side. They got to tape me down. It's a whole thing. Okay. And I'm laying like on my side like this. And I got my head over like this because this is where it has to go. Right. And they have me taped essentially down. Okay. And this thing across my face. So I can't see what's happening. All right. But they're telling me what they're doing the whole time. And a nurse comes over and stands in front of me, and she's got my hand and she's talking to me, and I can see her, but that's all I can see. Right. And so, she's telling me, okay, you're going to feel a little sting, and then some pressure. First of all, okay, pressure and pain are two different things, okay? But they never say pain, they say pressure, okay? Two different things, okay? when you feel pressure, it don't generally hurt, okay? Pain, that's a whole other thing, okay? That good stuff did not kick in time. So now I have to have more shots, okay, of the numbing of lidocaine, right? More of that. I feel every one of them, okay? And they give me a lot of them because they have to numb this whole area here, right? And then they have to give me shots up in here. No wonder they give you this medication, because you don't want to remember it. But I'm going to tell you something. It was traumatic, okay? Because I remember all of it. And when, thankfully, the numbing stuff started to happen as they're getting ready to put the disc in, because I could feel the pressure from the disc, okay? And then as they're hooking the catheter to my jugular vein, I can feel pressure from that, but not pain. Thank God, okay? But everything leading up to that, horrifying. I am ugly crying, okay? And I mean ugly crying. You know the type of cry where your nose is swollen 4 times the size and your eyes are swollen shut and you just have snot running. Your whole face is red and blotchy and it's ugly. Like, that is an ugly cry, okay? That is exactly what I did this entire time. Like, it hurt so bad. I was so miserable, so much pain. It was awful. And it's finally all done, and she's got the Dermabond on and everything all done, and they're taking me back, wheeling me back to what is the recovery room, because the recovery room is where you're supposed to go, because the stuff's supposed to make you loopy, the good stuff, and you need about 30 minutes, 20 to 30 minutes to get your wits about you so you can leave, right? However, the good stuff never kicked in for me. It still hadn't kicked in for me, and so they wheel me to the recovery room, and I'm just a snot fest. I'm a mess. I'm like, please have a tissue. Like, I must have looked like death. And this nurse, and she's like, you know, oh my gosh, I'm so sorry. That was just terrible for you. And I'm like, I could not. And I'm trying to explain to her what was going on. And she says to me, are you a natural redhead? And I said, yes. And she goes, okay, so this needs to be in your chart. And I'm like, what? And so that's when she starts telling me about this natural resistance and all this other stuff. And I'm like, that would have been good to know ahead of time. But, you know, lessons learned. You find out when you find out. So she's like, okay, so you're going to rest for a little while. In like 20 minutes, we'll go get your husband. And I said, can you please go get him now? Because I had enough. Like, I just wanted to be the F out of there. I was done. I didn't want to be there anymore. It was the worst day ever. And she's like, are you sure? And I said, yeah, I never felt anything from the good stuff at all. So, I mean, yeah, can I please just get my husband? So, let me tell you, before any of this happened, by the way, I had asked Jay if after I was done and in recovery, if he would come, when he come in, if he would take a picture, because I'm trying to document stuff, you know. In addition to this, I also have a scrapbook and everything, and I got pictures and I'm documenting everything. This is all part of my journey. So he walks in the room, phone ready, right? He walks in, he takes one look at me and literally is aghast, like steps back and in shock, look in his face, and was just in shock. And I'm like, what? And he's like, and immediately he's upset. He's like, what happened to you? Who beat you up? What went on in there? Like, he's worried about, because I don't normally look like death or like somebody beat me up or, you know, like it was bad. Okay. And I must have looked a fright. Okay. Because he did not take a picture. Thankfully, he did it. He's like, it was horrible. But it shook him. Like, it was just surprised. And so the nurse is telling him, she says she had a hard time with the anesthesia. And I looked at her and I looked at him and I said, no, not a hard time. I didn't get anesthesia. I mean, I got it. It didn't help. I still don't feel anything from the good stuff. And that was one of the worst experiences of my entire life. Like, it was awful. And so she's, we're talking for a few minutes, and I said, well, can we go? Because I just want to go home at this point. And she goes, well, we're supposed to keep you until you feel like you can go. I said, ma'am, I don't have any effects from the good stuff at all. Nothing. You've already taken my IV out. Like, there's nothing there. I just want to get dressed and go home. I got a long drive, and I just want to go home. And I probably wasn't as sweet and kind as I normally am, but that was a rough day, okay? And she was like, sure, absolutely. So she left. I get dressed. She brings a wheelchair in, and I'm mad. I don't want a wheelchair. I want to walk out. I want to get in the car, and I want to go. I've had enough, okay? And she's like, no, protocol, you have to go out in the wheelchair. And I'm like, oh, fine. So we get in the wheelchair. She takes me out. And now I'm sitting in front of the hospital because Jason still has to go get the car, right? So he goes and gets the car, and which is across the parking lot, up in the parking garage. There's all of this construction. The place is busy as hell, okay? So he has to hoof it all the way there, and I have to sit here. I wanted to go. When we got out there, I was getting ready to get out of my chair just to go. And he said, no, you stay here and wait, and I'll go get the car, and I'll bring you back. Just stay here. It shouldn't take me a few minutes. 15 minutes. Not his fault, because it was just a mess getting out of there. Just a cluster to get to me, okay? Meanwhile, I look so terrible as I'm sitting in this chair, this wheelchair, and I'm just sitting there slumped. I must have looked like death, or death was coming, because people are passing me. I had at least 3 people try to lay hands on me to pray for me. I have prayers here. I have people saying rosaries over me like literally, we'll pray for you. Like, people are literally, I think they thought I was going to die. I was thankful for their prayers. That was super sweet. But can only imagine what I must have looked like sitting there then if it was that bad. So finally, here he comes. And I get in the car and we go. Needless to say, as we get, because it takes forever for stuff to kick in for me. And we're going down the road, down the interstate. Okay, it's an hour and a half to get home. And we're just trucking down the interstate. And all of a sudden, the good stuff kicks in. Hard. Okay. And I start seeing things. Now, when you're driving down the road, you've been driving for a while, it's nighttime, whatever, you follow somebody and you see things, you hallucinate. Maybe you see something that may not really be there. Just kind of hallucinate. It was like that, except it's daytime, and I'm looking out the side of the road, and I'm just watching, out the side of the road. We're going through the canyons and stuff. And I'm messed up. Like, all of a sudden, I'm messed up. I can feel it. And I look over and see what I swear to this day, I know it's not true, but I swear this is what I saw. A massive gaggle of sea lions hanging out on the side of the interstate. Sea lions. We live in the mountains, y'all. The mountains. We're driving through canyons. There's no sea lions here. There's not a sea. The closest sea lion is probably California coast. Like, literally, that's the closest. I'm in Wyoming. There are no sea lions. Now, I know they're not sea lions, but this is what I'm saying. Hand to God, okay? And now, it's not uncommon to drive down the interstate and see a massive herd right on the side of the road of deer, elk, cow, sheep, buffalo, even sometimes, horses. Like, you're going to see them, okay? Anywhere, just drive along the interstate. But sea lions, not so much.